Good afternoon, everybody. This is September 18th, 2020. It's our weekly COVID-19 update from the Falmouth Health Department. My name's Scott McGann. Our website's falmouthmass.us. Our email is health@falmouthma.gov. And our phone number is 508-495-7485. As of today, we have 260 cases of COVID-19 since March 19th, were our first case. And these are all PCR tests, molecular viral PCR tests. There have been 12 confirmed cases during the period from September 2nd to September 16th. So a couple of them are local, most of them are local, a couple out of area acquired ones. That's more than we normally get, and we'll talk about that in a minute. Approximately 95% of total cases are no longer in isolation. Falmouth's approximately 13.4% of all cases in Barnstable County, with 14% being expected. The Contact Tracing Collaborative, VNA, the Health Department was still doing the contact tracing like we always would, doing the isolation and quarantining as needed. So that's our weekly case count. If you look at our chart, since about June, we've been averaging for most weeks but one, under 10. But we've had plenty of weeks where we've been less than 5 and even less than 3 or 0. And we need to get it back to that. Right now, our cases are still in that 5 or 6 to 8 range per week. Which is higher than I'd like to see it. It's more indicative of what we were in mid to late June, not what we were in early July. And we were doing well again in late August. So we've had sort of this up and down, but generally on a low infection rate. Less than 10 is a low infection rate for us based on our population. But still, I'd like to see it be better. If you look at since the beginning, you see we've had some, steep inclines early on. We're not at a steep incline right now, but we are projecting higher than I'd like to see. If you look at the state chart, this is the metric we use when we talk about reopening schools. We still do remain in the green. Gray and green is in-person. Yellow, the state suggests or recommends a hybrid, and in red would be totally remote. You can see Nantucket had a lot of cases, I think 30 out of their 78 over the last 2 weeks. So they had an event or 2 or 3 that occurred. But I'd like to see that get back to gray, which is less than 5 cases over 2 weeks total. So green means less than 4 cases per 100,000 population over a 14-day period. I think for us, that's roughly around 18 cases over 2 weeks will get us somewhere around there. So that's we're still in the green, which is good. We still recommend to proceed as we're going. But the case counts were a little bit higher than we've been seeing before. If you look at this shows you pretty good. If you look at the chart with the green and the gray, on 8/20 we were in the green at 1.1 average daily incident rate per 100,000. We had 2 good weeks in the grays of under 1, and then last week we were at 2.3, and this week we're at 2.7 with 12 cases. And we have 3 weeks where we've trended on the higher side. So we need to be able to we need to do better social distancing, not having parties, things that we'll talk about in a second, and everybody knows. To get the counts back, I like to see it back in the gray, as everyone else. We had about still averaging between 15 and 1,600 tests for every 14 days, so about 800 tests a day, somewhere in there. Our percent positivity is still less than 1, which is a key number. We're at 0.76, but we are trending the last couple of weeks in the wrong direction slightly. Barnstable County is 1.8, so we're higher than the county. We were at the county last week, and the 2 weeks prior to that, we were averaging less than the county. In terms of the state, we're still well below the state in terms of average daily incident rate. They're 4.6, we're 2.7. The state's percent positivity is 0.9, we're 0.76, but we've had it as low as 0.3 as far back as the end of August, and I'd like to see it get it back to that. If you look at these 2 charts that come up, the testing rate, so the chart on the left, you want to see is Falmouth down in the corner to be dark as possible, and the percent positivity to be a light color as possible. When they get to roughly the same colors, we're not having as good a week. So essentially what we want to see is a high testing rate and a low positivity, and we've had weeks where we've been better on that as well. So all these numbers sort of match up with the fact that we've had 12 cases within 14 days. If you look at the county's got that same up and down, bad during March, April, May, flattened out in the Junes, early Julys when just about everything was shut down. Summer comes, things start to open up, we see an increase, but then it sort of tails down, a little bit of an increase late August, early September, and that sort of floated down, and we just want to keep that down into what we were seeing in that June numbers, the 0, 1, 0, 0, that type of thing on a daily basis. They have on the 1,926 cases, that's confirmed and probable. Confirmed would be the PCR test. The probables would be things like the antigen test. And there's been 171 deaths as of 9/16. The daily case count as of September 17th, Barnstable had 3 cases for that day and no deaths. In other counties, you can see here, some counties like Suffolk and Middlesex counties have the most. More people, obviously, but Barnstable's in that 3, right? 3 for the count on yesterday. And this chart you can get from the daily site, the daily Mass Department of Public Health COVID website, which comes out about 4 o'clock every day. They also do a weekly on Wednesday. Some of the data, like the map that shows the red, green, and gray and yellow chart, is also that's done on a weekly basis around Wednesday, sometime around 5 to 6 o'clock. So yesterday we had we had a lot of tests done. So 27,000 tests, 419 positives. We've been averaging in the state somewhere between 250 and 4. On heavy testing days, you're generally going to see more tests that are positive. 15, we've been averaging between 10 and 20 deaths usually per day. Our total deaths in the state since the beginning is a little over 9,000. Our status on these yellow, the green, yellow, and red trends have remained unchanged probably for a couple months now, with healthcare system readiness and in the death from COVID being in the yellow and in progress, with all our other metrics showing as green, which is positive. Our daily, the weight of all tests, percent positive for the last couple of days has been 0.8. Again, the key is to keep it below 1 if we can. That indicates that the disease is on the downturn, not on the upturn. Number of cases in the hospital just recently went up the last couple of days. We were trending down the September, roughly the 10th through the 13th and 14th, and we've picked back up. Now, that could be a couple of nursing facilities, long-term care facilities that have had cases where that would go up because the hospitalization rate's generally higher among the elderly. It is, and so that could be part of it. I'm not quite sure. Number of hospitals using surge capacity, and again, it depends on what they have for bed counts and availability, is right around that 1 and 2. And the death rate is 10, 11 the last couple of days. Depending on the day, we've been averaging in that teens, 15, 16 or less, between 10 and 16 usually on a daily basis, according to this chart. If you look at our hospitalizations, the last 3 days are at 377 with 842 and 25 in here. If you look at Falmouth Hospital, we have been 0 and 1 for the longest time. We have 3. None in the ICU. We have not had anybody in the ICU, I think, since June, I want to say, at the latest. Cape Cod Hospital is currently 0 and 0. So there seems to be a slight increase over the last couple of days. If you look at September 9th through the 13th, you see that's been on a definite downward trend, and then we picked an upward trend. And again, that could be acute issues occurring at some of the long-term care facilities. There's various reasons for it. We don't really get that for the state. It doesn't really share that with us per se. I'm privy to what Falmouth is doing. If you look at the ICUs, we're down 2, then we were up 14, down 11, so we're sort of fluctuating there, but we're still roughly minus 17 from August 7th, so that's pretty flat. Minus 13 for the current intubations as of August 7th, so we're sort of at that slow, flattened out. These are pretty typical numbers that we see each day on ICU and intubated. Intubated means the vent. Long-term care facilities, there's been 5,941 of the 9,000 deaths have been associated with long-term care. That's right around 65%. That's been really consistent for several months now. We haven't had any, are pretty much unchanged in our nursing facilities. But I do, we'll have to double check that. But right now, I think we're pretty flat on our long-term care facilities and nursing facilities. Has been relatively flat. We haven't had a flare-up on that, thank God. As far as COVID testing, the drive-through remains unchanged. Falmouth Hospital is still doing it. Your physician would call the 508-862-5595 number. With an appointment, we'd have the testing at Falmouth Hospital. That is a PCR test. You can also get a PCR at East Falmouth CVS walk-in clinics, the Community Health Center of Cape Cod. And then also you can visit mass.gov/COVID testing, COVID-19 testing, if you're going to be somewhere else or looking for another spot. Those are the website to go to. And again, we are cranking out, roughly 1,500 tests every 2 weeks. Again, a little bit about the test. The PCR is the gold standard. That's the confirmed cases. That's where we get our 260 from. It shows that there's an active recent infection ongoing. There's viral DNA in the body. It does take greater than 24 up to 72 hours to even more, depending on how strained the labs are. But that is the gold standard to tell whether you have COVID-19 or not. Antigens are also good. They are rapid. They're not quite nearly as accurate. They're looking for antigens being produced by the body, and it is considered a probable under the Department of Public Health. We, as contact tracers, the VNA and so forth, will treat probables like confirmed, and we'll do contact tracing on a probable. Antibodies that would not do contact tracing per se, those are suspect that tell you that there's a past infection, because it's detecting antibodies that are floating around in the bloodstream after the infection is over. So PCR being the gold standard. Things are changing pretty quick on this. It'd be nice to get a really accurate antigen test or something similar that is rapid and cheap, and that's what I'm sure the feds and the states and everybody are working towards that. But now, this is sort of a slide I've had up for over a month now. It's sort of still the status quo. Flu shots. In order to keep the hospitalizations down and the confusion over, because flu does mimic a lot of the same symptoms as COVID, we want everybody to get a flu shot. September 26th, which is not tomorrow, this upcoming Saturday, it's the following Saturday from 8 to 12. Without an appointment, anybody in Barnstable County over the age of 6 months can go to the Barnstable County complex. I'll be there as well. All the health agents will. Enter the complex at the side of the driveway from Railroad Avenue, and the signs will be well posted. It's going to be in front of the old jailhouse that's out in the back. Okay, we're going to do the quadrivalent influenza vaccine, okay, which is 4 different viruses. 6 months and older, there's also high-dose flu vaccine available for over 65, and state vaccine is available for the uninsured. So if you want one now, that would be the place to go. You can also do your local pharmacies, your physicians, your pediatricians, the places that you normally get them will have flu shots. And the Falmouth Health Department, we're looking at setting up a by appointment clinic, because we can't have a normal clinic where everybody's sort of just showing up in terms of indoors and so forth. So we're looking at having a drive-through. The VNA prefers to do it by appointment, so I'll send out information as we get closer to that. I just want to make sure I have enough flu vaccine to do that, and so the appointments will really help us determine the need, as opposed to ordering and then getting rid of some and having too many or not enough, even worse. So again, we have a tentative clinic set up for October 26th, looking at a drive-through, probably at the Rec Senior Center by appointment, and details will follow on that. And I'll have it on the FCTV as we get that hammered down. So, and also schools need to have their the students have to have flu shots by the end of the year. Again, they can come to that clinic on the 26th. They can see their pediatrician, go to the local pharmacy, or wait for the Falmouth clinic I have tentatively scheduled for October 26th. Again, social distancing and face coverings still as important as ever, especially if we've had an uptick in cases. Not necessarily that we have community spread going rampant. That's not what those 12 cases would indicate necessarily, but we still need to make sure that we're staying home when ill. Businesses and entities all need to follow the state guidance if they have guidance for their specific sector. Travelers that need to quarantine upon arrival from locations with higher rates, that's always been a problem. People travel is one of the main reasons why you have 0 for 2 weeks and then start to get cases. A lot of times that does definitely come down to someone traveled and didn't quarantine, and then therefore you have cases. And so we want to make sure that people are following the quarantine. I think we have somewhere close to 2,000 people registered with the state in relation to Falmouth about quarantining upon arrival. Again, diligence with social distancing and face coverings isn't going to change anytime soon. Hand washing, hand sanitizing, and not coming in when ill are all key things that we need to do to make sure that we're not spreading COVID. The health department will continue to do the complaints on social distancing. Procedures not being followed by businesses, we follow up those as they come in. Again, on Main Street and in Woods Hole, you have mandatory face coverings, and face coverings definitely indoors, anywhere you are. Because of course the last thing we want to do is to undo the hard work that we've done so far. So to recap, the state metrics are slight increase, flat to slight. The hospitalizations the last couple of days have definitely gone up, and that might just all of a sudden come right down. And that does happen. The data does fluctuate. Falmouth has had an increase over the last 21 days or so. Everybody just needs to stay diligent with that. It's not at a point where we've gone to yellow. It's not to a point, we're still in the green, so we're still at a low infection rate, but not as low as we can get it to, and we have gotten it to in the past. So we want to get that back down as low as possible. The current level remains since, I think, June 8th at Phase 3, Step 1. So that's what I have for this week, and again, if you want to call us at the Health Department, feel free to do it, or you send us an email, and we'll do this again next week. Thanks.